Alright, so the point of this video is to help you complete your healthcare calculations from assignment number 5. The idea with assignment number 5 is that we have a family of 4 that confronts a number of medical expenses in a particular year. They have 10 office visits at a doctor's, they have pharmaceutical expenses, they unfortunately have to go to an emergency room, and they have a hospitalization. And the goal of this exercise is to help you understand what they actually would have to pay if they had 3 different types of healthcare plans. As we talked about in class, there are traditional fee-for-service plans, and that is represented by our 80-20 plan in problem number 1. There are HMOs and there are PPOs. So what I'm going to demonstrate for you is I'm going to walk through the calculations for the family that is a fee-for-service 80-20 plan. For the rest of your assignment, for problem 2 and 3, you will need to think through, use your critical thinking skills to determine what would be their annual healthcare expenses. You will have to put number 1 into your assignment, so pay attention as I do this and copy down into your notes. So if we want to determine this family's healthcare costs under an 80-20 plan, our first step is to calculate their premium costs. And I look at my assignment and I see that they have a premium of $200 a month. Times 12 months will give us $2,400 that they need to pay every month, even if they never draw any healthcare expense, even if they never go to a doctor or get any prescriptions, go to a hospital or anything. $2,400. Our next step is to determine how much they need to pay for medical and drug expenses. And you can see everyone has 10 doctor visits for $2,000 and pharmaceuticals cost $1,500. So that is for a total of $3,500. Now, does this family have to pay $3,500? No. They pay their deductible, which when we look at the assignment, we can see they have a deductible for physician's visits and drugs at $500 a month, or $500 a year. And then what we do, because they're on an 80-20 plan, is that we take 20% of the remainder. So we take $3,000, well, subtract the deductible and we get $3,000, right? $3,500 minus $500. And we take 20% of that. $3,000 times 0.2 equals $600. So they had to pay $500 deductible, and then they had to pay 20% of the remainder from the medical and pharmaceutical costs. And so they end up paying $600. You may notice that I'm writing some numbers in blue and some in black. Those in blue are the numbers that that family actually has to pay. So they pay their premiums, they pay their deductible, and then they pay 20% of the remainder of their medical and drug costs, or physician's visits and drug costs, at $600. So our next step is to figure out their hospital costs. If you remember, they did one emergency room visit and they had one large hospitalization at $100,000. So we look at the ER, and it says that the ER costs $1,000, and that hospitalization was $100,000, for a total of $101,000 in hospital costs. Now, fortunately, the family does not have to pay $101,000. We need to figure out how much they have to pay. So we'll take 20% of that, $101,000 times 0.2, leaves us with $20,200. Whoa, do they have to pay $20,200? Well, let's take a look. We first need to compare our hospital amount to our previous expenses. So how much have we already paid this year? We've paid $1,100. If you remember $2,400 in premiums, that does not count towards our maximum out-of-pocket expenses. So we'll add up our $500 and our $600 to $1,100. And then our maximum out-of-pocket, again, if we look at the sheet here, is $10,000. So what we'll do is we'll say 10,000 minus 1,100, because we've already paid 1,100, equals how much? 8,900. So you can see they incurred $101,000 worth of costs at the hospital, But after we took 20% of that and subtracted out from our maximum out of pocket, the amount that we've already spent, we see that they only have to pay $8,900 of the $101,000. So to finish off our calculation, we're going to add up everything they spent throughout the entire year, this family of 4. We add up all the numbers in blue, and we get to $12,400. So that was their total annual expenses for the year. Now there's one final thing you need to do before you move on from the 80-20 family, and that's you go to question number 4, where it asks us to use the results from the scenarios above to determine what percentage of the annual household income would this represent for different family incomes. So we'll start with $75,000 on the 80-20 plan. We would divide $12,400 by $75,000, and if my memory serves me, I don't have my calculator handy, but I think this is around 16 or 17% of their annual income. Then I'll ask you to figure out what that is, $12,400 divided by $50,000, and then again for a family income of $24,250. So, to complete the homework, you will write out all of the steps that I've just taken you through here for number 1. For number 2 and number 3, you'll have to use your critical thinking because it won't be the exact same steps. As we've learned in class, HMOs and PPOs have different benefits, so you'll need to think through what would the calculations necessary be to determine their family's total expenses for the year. So have fun with this assignment, and I look forward to discussing it with you on Thursday.